All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So the discussion today is about the type 1 allergic reactions or type 1 hypersensitivity reactions. Let's start our discussion. We will talk about the pathophysiology of the reactions and a little bit about what are the anaphylactic reactions and what are local reactions which are type 1 or allergic reactions. So let's start. It is actually a fascinating topic, and I am glad that we are discussing it. This relates to, sometimes COVID vaccines have anaphylactic reactions as well. So it relates to current situation as well, but generally this is a pathophysiology lecture in that area. I'll explain why I'm doing it. My original type 1 sensitivity reaction lecture has a break in it for which some part of the video is missing. So I had to redo it. So let's start a discussion. So this is drbeen.com. Here are the references. Again, I'll show you two type of references, one online references and the other the books. Online references are Wikipedia. If you do not like Wikipedia, you can study from somewhere else. This is the type 1 hypersensitivity reaction. This is a study about the innate immunity and its regulation by mast cells. Very interesting study. This is innate immune system and its components. This is mast cell, which would be the primary hero of our discussion today. And then this is the basophil, which is also another character, another cell that we will talk about. In terms of the books, the important books are two. Number one, this is Guyton and Hall textbook of medical physiology, Guyton Physiology 14th edition. So if you see here, atopic allergies associated with excess IgE antibodies, this is what we're going to talk about. So I'm going to close this. The other important book is this one. This is Pathology by Robbins, or we call it in medicine, we call it Robbins Pathology. So Robbins Pathology, type of hypersensitivity reactions, and then type 1 hypersensitivity reaction is what we'll talk about. So with this, let's start our discussion. So I have to go to my OBS, go to the screen share and start. So here we are. Get ready for the Dr. Bean illustrations. Okay, so question today we're going to answer this question, that what is type 1 hypersensitivity reaction? And one request I'll have from you is that as I'm preparing for Odyssey, I have switched my diagramming tool from Mischief to Photoshop. What do you think about this style? Objectives for today's discussion. Number one, what is the mechanism of allergic reactions? What is the role of immunoglobulin E? What is the role of mast cells, basophil cells? And then what is the role of T helper 2 pathway in this whole pathophysiology of allergic reactions? We should know these at the end of our discussion today. So some terms that we should be aware of before we can understand the mechanism. The terms are, what is a reagin? We'll talk about it. What are allergens? And then what is hypersensitivity? Why do we call these reactions? There are four types of reactions, which we say hypersensitivity reactions, type 1, 2, 3, and 4. Today, we're going to talk about type 1. So why do we call them hypersensitivity? We'll talk about that. So first of all, what is a reagin? So see here, this is a B cell, right? So this is a plasma cell, or on the left side, this is a B cell that has become activated. How do we know it is activated as medical students or doctors or nurses or nurse practitioners or nursing students? Number one, the nucleus is darkly stained, and nucleus has rough parts in it. That is because the chromosomes are open and DNA is working and it is functioning. And the function of the DNA is to open various genes and function with them. So because of that, the nucleus looks like a captain's wheel. You know, the captain of a ship, the ship in the water, the wheel of that ship, the nucleus looks like that. Secondly, the B cells are usually the active B cells. that are making antibody, they're usually larger on one side. I call this the pregnant belly of the cell because in here the cell is making antibodies which will then come out of it. So one important thing that we have active B cell or called plasma cells. Plasma cells make antibodies, we know that. Antibody type E or immunoglobulin E is today's important character. Mast cells, basophils, and IgE. This is a game of this. There is one more character, and that is allergens. We'll talk about that in a second as well. So IgE is produced. This IgE can then attach with the mast cell. So B cell produced IgE. That IgE is a protein. It goes and attaches to mast cells. Now, when it attaches to mast cell becomes primed. We call it primed cell. And similarly, these proteins can also attach to basophils. Now, what is a reagin? This antibody, IgE, that is sitting on a mast cell and that would react to an allergen is called a reagin. So we can say for our ease, IgE is, in today's discussion, IgE is reagin. So that is one term, IgE. Second, what is an allergen? So if you see here, this is a substance in the middle. This may be pollen, this may be part of a drug, this may be part of our food. This is some tiny particle. And the quality of this particle is that in majority of the people, when they are exposed to it, and that maybe they have eaten some food in which this particle is, for example, peanuts, or they are exposed to it, for example, pollen, or they have taken a medicine, for example, penicillin. So some particle to which 80% of the population does not respond negatively. And what does negative mean? Their immune system does not start fighting with this pathogen, not pathogen, with this particle. However, in about 20% of the people, these folks have some genetic inheritance in them that makes them respond overwhelmingly, abnormally to this particle. And again, this could be a pollen, this could be part of a peanut, this could be part of food, this could be part of a drug. Something is there to which 80% of the population is not responding and not caring, but 20% of population's immune system says, what the heck is this? I'm going to respond to this and I'm going to fight this. Such substances are called allergens. So reagin are the IgE. These particles that will bind to this IgE, allergens will bind to this IgE. So keep in mind throughout the discussion today that we'll continue to talk about the reagin and antigen. Sorry, antigen is the allergen and reagin complexes. In general term, we are talking about a particle that is allergic to us and an antibody that is IgE. Okay, continuing. Then is the question, what are atopic allergies? What are allergies? What is hypersensitivity reaction? Why do we call them hypersensitivity? So first of all, sensitivity means when something enters in our body, for example, SARS-CoV-2, or a bacteria or a fungus or some other foreign material, when that enters our body and our body responds to it with our immune system as an army to attack that thing, then we'll say that we are sensitive or our immune system is sensitive to it. Remember, we eat a lot of foods. We do not start attacking everything that we put in our mouth or we eat. We do not start attacking every particle that is in our breath. We do not start attacking everything that appears on our or comes in contact with our surface, our skin, for example, or conjunctiva or nasal surfaces. but we attack some. We attack bacteria, fungi, viruses, sometimes pollen, and so on. So, whatever our immune system attacks, we say that we, the host, is sensitive to it. Now, being sensitive to it is not a problem. For example, if SARS-CoV-2 appears in a person's body and their immune system responds to it normally and wipes it out, that will be sensitization to the SARS-CoV-2 with a normal, understandable, reasonable immune response. Hypersensitivity means that immune system decided that I'm going to respond overwhelmingly. I'm going to respond more than I should be. It is an abnormal response. It is a pathological response. So the triggering factor, the antigen, in this case, allergen, may not deserve to have such a strong reaction. And then there is a strong reaction. And our body in that process not only eliminates or tries to eliminate the allergen, it also damages our own self as well, in some cases, killing us. So, this kind of response, this abnormal pathological response, is called hypersensitivity. It is also called atopic allergy because it is an abnormal response. It is not ordinary response. It is not normal response. And some qualities of this, it is generally inherited from parents. It usually involves I have to figure out back here. It usually involves IgE. And IgE, what is the name of IgE for today's discussion? Reagin. What is the name of the antigen in today's discussion? Allergen. Mast cells and basophils are two primary players in this discussion. There will be neutrophils, eosinophils, monocytes involved as well, but they are secondary characters. They will be invited to come over, but the original starting characters are going to be mast cells and basophils. And it is so bad that one mast cell, can have 500,000 IgE molecules attached with it. And when those molecules become stimulated because of the allergen or this irritant substance, which we are calling allergen, mast cell would just go mad and become degranulated. It would release stuff from it. It would release chemicals, acids, poisons. It is actually trying to help us, but these become poisonous for us. This is also called immediate reaction, because many times anaphylaxis or type 1 allergic reaction occurs as soon as we are exposed to some allergen. Usually the first exposure does not cause a problem. It is the second exposure and third and fourth and so on. So these are our terms for today and the cells that we'll talk about. Now, one quick thought about mast cells. There are lots of studies, there are lots of research to figure out why do mast cells kill us sometimes. So mast cells are not all that bad. Mast cells are, of course, immune cells. They are sitting there to help us. They help us against, for example, worms. Helminthic infections are usually taken care of by eosinophils and mast cells. So they take part in that. Mast cells help against some bacteria as well. Mast cell help clear out some of the snake venom as well. So they were actually historically good cells for us. But nowadays, sometimes they go in this real troll phase and start killing us as well. Now we're going to go in the details. The very first thing, so we have to go step by step. Type 1 allergic reactions is a complex pathophysiology, but if we go step by step, it is actually easy to understand. At the end of the day, if you just wanted to see what is the summary and I want to disengage now, then the summary is that mast cell would degranulate. The chemical substances that they would release would can cause systemic circulatory collapse and kill a person. They can cause bronchoconstriction and choke a person because of the breathing problems, and they can cause severe vascular dilatation that would result in hives and inflammation and edema and congestion and so on. Now, details. First of all, what arm of the immune system is involved? We know that we have innate arm and we have adaptive arm. Within the adaptive arm, we have T helper 2 pathway, which is called humoral pathway, and that is because it makes antibodies which are released in humor. Humor is the fluids of the body. And we have cytotoxic pathway, which is T helper 1 pathway. For allergic reactions, for anaphylaxis, the pathway that is engaged is innate arm and then adaptive arm T helper 2 pathway. This is important to keep in mind. This is a T helper 2 pathway related abnormality. So if you see here, on this side, we have the innate arm. So this may be a dendritic cell, this may be a macrophage. Once the allergen or pathogen, whatever thing is going to trigger these cells, that is received in the body, these cells would activate the adaptive arm. In the adaptive arm, the very first cell is going to be naive T cell. When the naive T cell connects with macrophage or dendritic cell, there is a co-stimulation that occurs. There is interleukin 4 if present. Then we say that the naive T cell will become T helper 2 cell. This also needs that IL-12 should be absent. If you put IL-12, interleukin 12 on a naive T cell, then it will become T helper 1. But if you have the absence of interleukin 12 and presence of interleukin 4, then a naive T cell converts into T helper 2. That is the pathway we're talking about. T helper 2 in turn releases interleukin 4, interleukin 5, interleukin 10, interleukin 13, and a bunch of other chemical substances. Here in today's discussion, it is interesting to keep in mind 4, 5, and 13. I didn't write 13 here, but imagine if 13 is written here as well. Interleukin 4 is important to convert a B cell that is going to make immunoglobulins. It is going to convert that B cell to start making IgE, Reagin, the one that primes the mast cell, the one that works with the mast cell to make mast cell go crazy. That is the IgE. And who makes the B cells to make more IgE? Who does the class switching help? That is T helper 2 cell. And how does it help the B cell? It releases interleukin 4. So interleukin 4 is for the class switching towards IgE, and we'll talk a little more later on. So if you see here, this is a B cell, naive B cell. It was not active, but now it is combined with T helper 2, and there is the presence of interleukin 4 and 5. So B cell would now start proliferating, that means more cells, and differentiating, that means becoming more active. In addition to that, it would do class switching under the influence of interleukin 4, and the plasma cell would start making IgE at some point. So from this presentation here so far, if you wanted to take away what arm of the immune system is responsible, it is T helper 2 pathway, not arm, but pathway. Now what happens is, once the T helper 2 pathway is engaged and interleukin 4 is present, then what happens is that the plasma cell does class switching. How does class switching work? So if you see here, inside the plasma cell, inside the B cell, there is genetic material, there is DNA that can help a B cell make immunoglobulin G or M or D or E or A. The sequence of the genes is MD Gia. I remember it this way, that imagine you go to a doctor, her name is Gia, and she's an MD, she's a medical doctor, so MD Gia. So immunoglobulin M and D are made together. Then we do a class switching, that means we remove these genes and we make immunoglobulin G. Then in the presence of interleukin 4, we remove the gene for G, and we start making immunoglobulin E, and then we can do further class switching to make immunoglobulin A. Not all B cells would do class switching in this way. Some will continue to produce D and not class switch. Some would continue to produce G and not class switch. Some would continue to produce E and not class switch. Some will continue to produce A and they don't need to do further class switching. Once a class has been switched to the next level, the B cell cannot go back to the previous immunoglobulin because that DNA part is actually removed. So a B cell that has lost the capability of making immunoglobulin G, for example, and it has gone to immunoglobulin E, that B cell can never make immunoglobulin G again because that part, the gene, is removed. It's spliced out, it is cut out, it is destroyed. So that is like if you have a recipe book and you're cooking recipes, one recipe every day, and every day when you cook a recipe, you tear that page out and you burn it. So the next day you're going to cook the next recipe and you cannot go back to the previous one because that page is gone. This is what is called class switching. Then once we have done the class switching, so imagine what's happening. Allergen came in, innate arm became active, naive T cell became T helper 2, T helper 2 activated a B cell to make it a plasma cell did class switching and started making IgE. Now those IgE are present in the body. Reagin is present in the body. This IgE is going to, so if you see here on the left, there is a naive mast cell. It's a normal, happy, healthy mast cell. The IgEs produced are going to go and coat. They're going to get attached to the mast cell and basophils. Basophils are, imagine they are inside the blood vessels, and mast cells are in the tissues. They both have receptors to bind with the immunoglobulin. These receptors are called FC. So if I can write here, FC gamma or immunoglobulin. So here they are FCE, immunoglobulin E receptors. So they are fraction constant for immunoglobulin E receptors. Essentially what that means is that they have receptors with which IgE can bind. Once IgE has bound to a mast cell, that mast cell has become primed. It is now a bomb that if the allergen comes and attaches here, this mast cell is going to blow up and in that process cause a lot of hurt to us as well. Now, mast cell degranulation. Once mast cell is primed, and how can a mast cell be primed? This can happen, let's say I am allergic. I'm not allergic to anything I know other than a couple of drugs. But let's say I'm allergic to peanuts. The very first time I ate peanuts, my B cell will make IgE eventually against the allergen in the peanuts. Those IgEs will go and attach to the mast cells, and I will usually, the very first time when we are exposed, I will not have a response to the allergen. It's just that my mast cell have now become primed. And so I ate peanuts, I'm okay. A few days later, I ate peanuts again. This is the second exposure. Now the mast cell was already primed. It has the IgE sticking on it. The allergen, when it is taken in the body, in the circulation, and those allergens, when they go and connect on the mast cell, usually one allergen, if you see here where I'm highlighting, one allergen has to bind or connect two adjacent IgEs. So this is like, for some weapons, there are two keys, at least in the movies, I see that there are two keys and there are two people. and they both say, okay, you turn this and you turn this, or one would input their code and then the other one will input their code, and then the weapon system will become active. Same way, on the mast cell, the allergen has to connect two IgE molecules simultaneously, and that would then cause an internal signal, and the mast cell would blow up. It will degranulate. Now, degranulation means either the mast cell and basophil will rupture and release everything what is in there. That is what I'm calling blowing up. Or it would just release the chemical substances stored in it without rupturing, without dying. Either way, mast cell is going to release a bunch of chemical substances. It is these chemical substances that cause the hurt. So does it make sense? Allergen came in, IgE produced, IgE went to the mast cell, allergen came in again, connected to IgEs, mast cell became degranulated. Now there will be chemical substances released that are going to hurt us, even to the point of sometimes killing us. So what is the hurt? How does the degranulation hurt us? So mast cells have chemical substances in them. Most important one is histamine. So these are vasoactive amines. Histamine is an amine. It's a chemical substance that is called an amine. So inside the mast cell, there are small pockets in which these chemical substances, poisons, are sitting in there. So vasoactive means substances that are going to make our blood vessels do something. These are called vasoactive substances. So vasoactive amines are present. So most important one is histamine. Histamine will be released. When histamine is released, histamine is a potent vasoactive substance. It causes vascular permeability change. What does that mean? That means it causes gaps between the cells of a blood vessel. So if you look at my hands for a second, imagine these are two cells and they are tightly joined with each other. And so fluids cannot come out of there because these cells are tightly connected. But if they shrink a little bit and they become separated, now there is a gap between them. So histamine can help the endothelial cells of the blood vessels to shrink. That causes, when all of them shrink, there appear gaps between them. Those gaps are useful for the products from the blood or the plasma to leak out of the blood vessel. Now there's a problem. We don't want the plasma to leak out. This is not normal. We didn't want this. So the result is, imagine in the whole body, blood vessels, endothelial cells contract, gaps appear, fluids ooze out, fluids leak out. There are going to be two problems. Number one, there is going to be edema everywhere. There's going to be congestion everywhere. There's going to be fluid everywhere. Imagine if there is fluid filling in the lungs. Is that a good thing? No, that's going to cause a problem. So many tissues would stop functioning correctly because of this extra squishy material in there. And secondly, we need fluids inside the blood vessels to maintain our blood pressure. So our blood pressure would start falling. Sometimes blood pressure falls so much that we cannot keep the tissues perfused correctly. We cannot bring them oxygen correctly. We cannot bring them nutrition correctly. We cannot wash away the waste products correctly. The result, tissues start dying. This is what is called circulatory collapse and death, or shock can occur after that. So vascular permeability increase is not a joke. Second is vasodilatation would occur. So not only permeability has increased and fluid has leaked out, the blood vessel has dilated as well. So when the blood vessel dilates, when it becomes all lazy and it is not maintaining its tone, that also causes a drop in blood pressure. Our blood vessels are continuously changing their tone to maintain the blood pressure. If I just stand up right now, my blood vessels would constrict to make sure that the blood pressure is maintained and the brain gets the blood correctly. Otherwise, I'll become dizzy and I'll get this, that dizziness spell for a second, postural hypotension. Our blood vessels are continuously changing their diameters. And now imagine you put histamine on them, endothelial cell cannot shrink anymore, cannot uh, move anymore. The smooth muscle cells of the blood vessels are in spasm as well, and blood vessel is not active anymore. This is sufficient if it happens with the right intensity. Just this much of a mechanism is sufficient to kill us. So that is one, histamine. Then adenosine or adenosine is also part of the mast cells. When adenosine is released, that causes severe bronchoconstriction. Plus, it inhibits platelet activation. Plus, it is chemotactic for the inflammatory cells. So, this person is going to experience difficulty in breathing and choking. And there are many, many reasons for them. One of them is adenosine causing bronchoconstriction. You will see a little later some prostaglandins causing bronchoconstriction, that is airway becoming tight and the smooth muscles of the airway contracting. Plus, there is more mucus produced because there is fluids leaking out of the blood vessel. Plus, some of the chemical substances actually trigger the mucus producing cells to produce mucus. So imagine the poor airways condition. One, it is constricted, so air cannot go in and out easily. Top that off with congestion around the alveoli, so exchange cannot happen correctly. Top that off with the mucus secretion in the airway to further plug the airway. Enough of a recipe to kill the person again. So if the blood vascular system's collapse did not kill, maybe the respiratory system would kill. So there are so many things that are happening simultaneously that can kill a person on the spot. So adenosine is released as well. Then what? So this all is coming from mast cells or basophils. Inside the tissues, mast cell, inside the blood vessels, basophils. So even blood vessel, so when basophils that are sitting inside the blood vessel and they start degranulating, guess what are they going to kill? What are they going to disturb? What are they going to impact? Blood vessels themselves. Further, the amines produced are chemotactic, meaning it's not sufficient for them that they have caused leakage of the fluids there, or they have caused vasoactivity, blood vessel dilatation, and other such problems. They are now going to call immune system cells to come in that area and start attacking the tissue and allergen there. So the war is on. Now, the immune system cells, for example, monocytes would come over, neutrophils would come over, eosinophils would come over, macrophages would come over. They would come and they would cause further destruction and release further cytokines and chemokines, which would cause even more immune system cells to come over there. And this cycle, if not broken, would just kill the person. So here we have a third reason for a person to be either damaged severely, the tissue, or the person dying. So chemotactic factors, neutrophil, eosinophil, monocyte, macrophages, they would come over. Then mast cell release proteases. Proteases, as the name is saying, ase means an enzyme. Protease, an enzyme that will break proteins. Why are they releasing these things? They are releasing them. They think they are killing a worm, but they are actually killing us accidentally. Proteases are to kill the worm. They release protease near a worm, and the worm's proteins start getting digested. This is like pouring acid on the worm, and the acid would kill it. But here there is no worm. It's the proteases that are going to kill our tissue system. Then Proteoglycans, for example, heparin, they are also potent number one vasoactive materials, plus they can cause inflammation. So all of this is not only causing tissue damage, it is also causing inflammation. This is why people with mast cell issues, mast cell activation syndromes, they have chronic inflammations because mast cell continue to release things like histamines and heparins and adenosines and proteoglycans and proteases. For example, tryptases are the ones that they release. There's not one chemical. Just blocking histamine is not sufficient because mast cells are releasing much more. Histamine is an important, potent part of it. Okay, continuing. Then this is another big issue, and that is, look at this diagram here. And I have done this discussion before in the aspirins chapter, and we talked about prostaglandins. So I'm going to briefly talk about that over here. This is kind of a test for you as well, that do you remember all those things? In our cell's membrane, there are cyclooxygenases enzymes, and there are phospholipids that are present. So in this cell, I have taken a piece of the membrane. We know that the cell membrane pieces are made up of double layer of phospholipids. There are phosphates and there are lipids in there. We can use the cyclooxygenase like enzymes, and we can break the phospholipids, and then we can make chemical substances from them, which themselves, these chemical substances, are potent vasoactive systems and pro-inflammatory molecules. So a cell under stress, this is not only just for the mast cell, other cells do it too. A cell under stress can take things from its cell membrane and make chemical substances from there, which are used to signal other cells, to immune cells, to come and help. These are like smoke alarms a cell raises. And mast cells are masters of that. So what they do is they take from their membrane phospholipids and they make arachidonic acid, they make platelet activating factors. From the arachidonic acid, they make prostaglandins, they make leukotrienes, and these are potent chemical substances. And we'll talk about them in a second. Do you see how damaging this whole thing is about to become? Or as you can see, it is becoming. So the result of all of this is what? Number one, there is intense bronchospasm. There is increased in secretion of bronchial airway, what are these glands as well from them. And this is under the PGD2, prostaglandin D2, that causes it. So airway is tightened and it is filled with fluids. So where is the air going to go in and out from? The pathways are becoming obstructive. And you can see that my drawings are less because I've been drawing since the morning, and by this time I ran out of time, so I just typed it. So leukotriene C4 and D4, they are potent vasoactive and spasmogenic agents. That means, once again, they would cause the blood vessels to shrink and they would cause them to become paralyzed. That would cause fluids to leak out of blood vessels. That would cause congestion in the tissue plus reduction in blood pressure, which can cause circulatory collapse and kill a person. So not only histamine did it, here leukotrienes are doing it. Do you know that leukotrienes are several thousand times more potent on per molar basis than histamine? So we are always looking for histamine. We need to do something about histamine. Leukotrienes are thousands of times more potent compared to histamine to cause vasoactivity. And leukotrienes either come from the inflamed, damaged tissue, or they come from the mast cells, or they come from the basophils. Every tissue that breaks down can produce leukotrienes, but these are special cells that make them as a weapon. Leukotriene B4, highly chemotactic. Chemotactic means a chemical substance that is going to bring in other immune cells to that area. Neutrophils come over, eosinophils come over, monocytes come over. These guys that would come over, they themselves would start attacking the tissue over there. The poor tissue had nothing to do with all of this. And everything is coming over and harassing that tissue and damaging that tissue and destroying it. Then there are cytokines that are released. Tumor necrosis factor is released. Interleukin 4, 5, interleukin 13. Now, 4 and 5 are T helper 2 pathway that we saw before. That is responsible for class switching plus IgE production. Interleukin 13 is also produced by T helper 2 pathway, which causes the epithelial cells to make more mucus, so the surface cells everywhere, the mouth, the nose, conjunctiva, other wet surfaces. IL-13 asks them to make more. So the wet surfaces, especially the airways, become even more congested. And mast cells are not just happy trying to kill us right away. You know that anaphylaxis attack can occur right away, right? Within minutes. They can act in 2 phases. This is why sometimes asthma attack is in 2 phases. Phase 1, immediate after some exposure, and then 10 hours later, another attack. And what is happening is these mast cells, they have 2 ways to attack us, trying to help us. One is they have stored vesicles, they have stored chemical substances. They release that immediately as soon as they become upset. And we know that mast cells are not just becoming upset because of IgE or allergens. They can become upset for many reasons. You ran or you jumped, or there is some mechanical issue, you stood under a shower, or your temperature changed. That can trigger them. So they can release their substances, pre-made substances, right away. So you can imagine that they have, just like snakes have venom, mast cells have their venom prepared and placed in them, and they can release that right away. Then as they become active, they'll start making more venom that they would release in 10 to 18 hours. And then a person would have anaphylaxis now or an allergic reaction now. They'll feel better in an hour if we have saved them, and they'll say, all right, I am out of it. What they don't know is that in 10, 12 hours, they may get one more attack. So 2 phases. There is pre-made chemical substances, and then there is newly synthesized chemical substances. So here, I spoke about this before, and here it is in writing. So there is an immediate response: vasodilatation, vascular leakage, smooth muscle spasm. Please connect it. These terms don't seem that dangerous. But look, vasodilatation can cause circulatory collapse by reducing blood pressure to nothing. Vascular leakage would cause congestion of the system, removal of the fluids from the vascular system, bringing the blood pressure down, causing the tissues to become congested and not function correctly, and kill the person. Smooth muscle spasm, airway spasm, smooth muscle, GIT smooth muscle spasm, blood vessel smooth muscle spasm, person can die. This starts within minutes, usually ends in 60 minutes. Why? Because there's not enough chemical substances in the mast cell to keep going for a long time. And luckily, these chemical substances, once they're released, they have a half-life. They very quickly get degraded. So these chemical substances are not going to stay there forever. Within 60 minutes, they are degraded and removed. But then the second phase of venom production starts. Mast cell now go home and say, okay, I need to make more venom. I'm going to attack this thing again. So what do they do? Within 2 to 8 hours, they start one more attack. This attack can last for several days. And in this, they would create inflammation because of those leukotrienes and prostaglandins and tumor necrosis factor and more immune system cells over there, and they're releasing their own chemotactic factors and cytokines, a war has started now. And so inflammation would occur. So first phase, immediate phase, vasodilatation and smooth muscle spasm occurred. Second phase, inflammation has occurred. Tissue is still getting destroyed. We are still at risk. Inflammation and tissue destruction is occurring. Neutrophils are there, eosinophils are there, lymphocytes are there, T helper 2 cells. Neutrophils are innate arm. Eosinophils are innate arm. Lymphocytes, T helper 2 are adaptive arm. So both systems have become active and they're going to start attacking. So this is the discussion. What is the clinical outcome of all of this? The clinical outcome of this is, I'm going to bring myself back here. So the clinical outcome, it really depends where the attack is, where the exposure rate. It could be localized attack or it could be a systemic attack. I'm trying to see where did I write that. Okay, so there is some more. Please give me 1 second. So there is a systemic response. Systemic response means the whole body now has a problem, and that response is anaphylaxis. What would happen in that? In the anaphylaxis, there is going to be itching. So there is going to be chemical substances under the blood vessel, under the skin. Plus there is going to be vascular leakage and congestion under the skin. Plus there are chemical substances that are going to irritate the nerves under the skin. So the result is there's going to be itching, urticaria, or the hives, those raised red areas. Then skin erythema, redness of the skin would occur. Bronchospasm would occur, respiratory failure can occur, and mucus secretion would occur. GIT musculature could become spasmodic, resulting in nausea, vomiting, diarrhea. It could actually not only become spasmodic, which would cause severe pain, then it can relax as well, which would then cause incorrect peristalsis or stoppage of the peristalsis. When the peristalsis is reversed or stops, we get nausea and vomiting. And when it increases, we get diarrhea. When the secretions in the GIT increase, we can get diarrhea. So GIT will become upset. This is why you would see that many folks with the mast cell activation syndrome have GIT side effects. Then vasodilatation and hypotension can cause anaphylactic shock and kill a person. I've said that multiple times, important. And finally, local responses. So the local responses under the skin urticaria, and it is possible just that happens. We know that some people, for example, get hay fever, or some people get under the skin irritation for some time. There are people who just get GIT diarrhea because, let's say, they have ingested something that has caused just a GIT to be upset. Or some people have inhaled something, let's say pollen, that has caused an asthmatic attack in them. So it depends where the allergen went. It depends what kind of response it has triggered. We might end up with a local response, or we might end up with local and systemic response. So that is the discussion. Thank you very much for listening. Tell me, how is this style? Of course, with this Friday is the first time I'm going to try. So I'm still trying to get. I was planning to go to Odyssey sooner, but I wanted to make sure that I can run this system and work with it before I relay to Odyssey with this. And this Friday, I'm planning that we'll do an Odyssey session. With this, thank you very much. Please like, subscribe, and share. And if you would like to support this work, there are 3 links in the description. You can use them to either buy me a coffee or become a patron, or use PayPal to support. I would see you in a few minutes. Thank you. Bye-bye.